We had a patient who was a marketing professor at USC in the MBA program. And one of the things that she said was, wow, your exercise app is amazing. You should really be marketing this when you talk to your potential patients about coming here. My name is Carina Testa, and I own AIM Physical Therapy in Hermosa Beach, California. And I have been a PT Wired customer from the start. I think I'm customer number 2. I have an outpatient orthopedic practice and currently have 6 physical therapists. We're about 4.5 FTEs. We're mainly sports, ortho, and dance physical therapy. I've also been a Prompt user since the summer of 2020. And with the integration of Prompt and PT Wired, that's been great. That really helped pull everything together. We started with PT Wired simply for our home exercise program because of the functionality of being able to create an app that looked like our clinic and to be able to have videos of all our exercises rather than just static pictures. Also the ability to upload our own videos or our own exercises. That's now morphed into just being able to put in a YouTube link, which has been a lot easier. That's what I started out first, was really just for a much more comprehensive and user-friendly home exercise program for all of our patients, as well as for our staff. So 2023 is the first year that we implemented it, and we implemented it slowly, and trips and falls here and there. We made some mistakes, learned quickly that, you have to build codes together and you can't bill them separate times of the month. I know that year in 2023, I think we brought in about a little over 40,000 in revenue from just RTM. To give some context, we were a little bit smaller back then. We were probably 3.5 FTEs. And in general, our caseload is about 40% Medicare. And that's all we chose to bill. In 2024, we really dialed it in better. We had grown a little bit in size, and we ultimately hit a total revenue of $68,000 for the year of 2024. Based on claims, Medicare claims added an additional about $20 per claim. So far, 2025, year to date, obviously not all of June has been paid, but we're at about $33K. Luckily with Prompt, I can dial that down and say, hey, exactly how much was I paid for specific CPT codes, and I pull that by just the RTM CPT codes. One of the things that we strive for here is what we call a proper discharge. And that means that a patient has completed their plan of care, actual discharge visit has been done, and that number continues to climb, and I guess significantly high compared to other calculations or stats that I've heard across the country. I think we're currently at 58%, which is pretty high. It's a combination of factors. Certainly, obviously, the care that we deliver, the type of setting that we're in, we have a great admin staff, but the home exercise program has to be part of that as well, because when patients are more compliant with that, then they are more compliant with everything that we suggest, and they have better outcomes. I was looking at some historical data trying to figure out what percentage of time are my therapists spending doing RTM. So I just pulled some of that data, and somewhere between 5 to 8% of their hours are spent with RTM stuff, monitoring or billing or whatever. That was an interesting statistic. People always say, well, is this really a big burden on therapists? I don't think 5 to 8% of time is a big burden, in my opinion, to do the monitoring and do everything that is required for RTM. It does take me a few hours throughout the month, but it's worth it.